name's Sarah Partridge. I work for the Multi-Professional Support Unit, and I'm delighted today to introduce you to Ali, our Nursing Associate Rs Ambassador, who's going to deliver us 2 presentations today. I'll let her explain everything, and I'm just going to hand over. Thank you.
Hello, my name's Alison Ayliffe-Jessup, and today I'm going to talk to you about the Nursing Associate role. So hopefully by the end of the session, you'll have an understanding about the role and how to make the most of it in practice. So it's going to be a 2-part presentation today. Session 1 is going to be about information for anybody that's thinking about doing the training for the Nursing Associate role, and also for the employers who are considering supporting their colleagues to undertake that training. So I'm going to talk a bit about my role as an NA, my role as an ambassador for Nottingham Alliance Training Hub, what the Student Nurse Associate training involves, and also how to apply. And then the second part of the presentation is all about hints and tips to get the most once the Nursing Associate is registered in practice, both for the employer and for the Nursing Associate. So it's about what the Registered Nursing Associate can bring to your nursing teams, and also looking at further development opportunities to upskill staff. So hopefully it'll be a really useful session, and I can really champion the role of the Nursing Associate. So a bit about me, first of all. So as I said, my name's Alison Ayliffe-Jessup. I'm 53 and I'm working full-time at Southwell Medical Centre, and then I work as a NATH ambassador on a Thursday afternoon. So I qualified in January last year, so I've only been in the role as a registered nursing associate for about a year. I had a previous career as a primary school teacher, and then I was a healthcare assistant at Southwell for 10 years before I had an appraisal, and my nursing manager suggested that I undertook the apprenticeship, and I haven't looked back since. And then I qualified in the January, and then I started as the Nursing Associate Ambassador while I was just completing my course, and I've been doing that on Thursday afternoons ever since. So the Nursing Associate role was brought in as a clinical support role to support and bridge the gap between a HCA and a registered nurse in primary care. Nursing associates can undertake clinical tasks, but they can also contribute to the planning, delivery and evaluation of care. So they look much more in depth at patients, and they can perform more complex and significant tasks than the HCAs, which then enables the registered nurses to concentrate on those really complex patients or clinics that need the registered nurse role. And NAs very much work within the nursing team in primary care, and also within the wider team at practices in primary care. So working alongside the GPs, clinical pharmacists, the physios, were all part of the same picture. So my role as Nursing Associate Ambassador I've been doing for about over a year now. And it's about connecting and supporting student nurses, nurse associates and registered nursing associates in primary care across Nottinghamshire. And I very much champion the role of the nursing associate, encouraging people to take up the training and then supporting them as they develop their careers in practice. And a lot of my role is about developing understanding of the role, because I think that's the key to it, that the understanding of the nursing associate role and what it can bring to practice is really important. And also about recruiting, once recruited, retaining those nurse associates in primary care, and what managers can do to help that, so people stay with you and become more skilled and don't move on. So the apprenticeship course involves a 2-year foundation degree. I chose to do mine at NTU at the Clifton campus. And then once you've done the 2-year degree, you qualify as a registered nursing associate. So the course, in terms of time-wise, because I know that's always an issue with primary care, it's 20% what they call off-the-job training, which equates to 1 day a week at university, 935 protected learning time hours need to be achieved in practice across those 2 years, but you can be quite creative with those protected learning time hours. So they're very much working with the registered nurses, but also GPs and the wider team in practice to do training together, but then also to work together, do some team working, do debriefing and reflecting on practice to achieve the protected learning time hours. And then 20 weeks of the 2 years is for external placements in all full fields of nursing. So that's time out of practice to undertake placements. And that's a really fantastic opportunity. I thoroughly enjoyed my placements. And what I did was chose things that would be relevant to my practice at Southwell and asked to have placements. So you can have, excuse me, you can have a certain amount of autonomy with sorting out placements or liaising with the team about where you'd like to go. My final placement in my final year was 7 weeks at Kingsmill Hospital, and I had a base ward, but then I asked to go and work with all different teams across Kingsmill and have insight days, and that was really useful. And I found I've used a lot of what I learned from there in practice every day. So the study modules across the 2 years I've outlined here. So professional practice and accountability, promoting health and well-being, and looking at lifestyle choices and how you can use that in clinics to improve health outcomes, person-centered care, applied anatomy and physiology, essence of care, looking at different therapeutic relationships and considering how you use them, managing long-term conditions, leadership and teamwork, and then towards the end of the course, more on supervision, assessment and communication and how you can support other staff within your nursing teams and also students should they come to practice. And then for the course, the assessment of the students is through a pebble pad, so the practice assessment document, an ongoing achievement record, and this is where you get opportunity to record your protected learning time hours and reflect on your practice. There is a certain amount of essays and academic writing, also reflective accounts, which is really useful when you come to revalidate. Objective structured clinical examinations, so for instance doing a meds round, presentations, which is good practice for them to use at work when you're presenting things, academic posters, multiple choice and short answer exams, professional discussions, and a medication calculation exam. So they're all lots of different ways of assessing you. So I know I get asked a lot about student nursing associates about the academic writing, because that can appear to be quite daunting, but you get an awful lot of support and you're also assessed in lots of different ways. So there's opportunity for everybody to shine. So once you're registered, then you're registered with the Nursing and Midwifery Council, and the NMC have ensured throughout the course that nursing associates can demonstrate the skills and knowledge as set out in the standards, and the study modules reflect those NMC standards. And as registered professionals, nursing associates are committed to providing that safe and effective care because they're registered accountable professionals. And then once on the register, NAs will develop their skills and knowledge as their career progresses and are part of the revalidation programme. So if you've got any HCAs or any support staff that are looking to do the course, what do you need to apply? So you need a GCSE grade 4 or C in maths and English, or a level 2 qualification in maths and English or functional skills. You need to be working for 30 hours a week on a permanent contract for the duration of the 2-year course. Commitment from the employer, and that's a big one. I found that I was very lucky because my practice managers and my nursing manager were really committed to me achieving the 935 hours. And it's all about teamwork, isn't it? And working out how we could achieve that together with the least disruption to patients and to clinics. Funding to pay educational fees, which you can apply to via NATH, and I've put some links there to email addresses which could be useful. You need to make sure that you have got that provision in your practice to support and develop you as a student, and flexibility to accommodate the 20% off the job training and the protected learning time. So that's the 1 day at university for the duration of the 2 years, and then the 935 hours over the 2 years. But as I say, those protected learning time hours, we found that you could be very creative with how you achieve those, and it didn't just have to be me sitting in with the registered nurse. It could be like a lot of teamwork so that you were seeing the same amount of patients. And then if you've got any questions, or if you've got a student nursing associate who's undertaking the course and you would like me to contact them regarding the network work, or if you've got any questions or want to meet with me to discuss the course in more detail, then don't hesitate to contact me.
Brilliant. Thank you so much, Ali, for that. So I'm just going to open up to the floor, and as Sheila is typing, do you have any questions about training or becoming a nursing associate or things like that? So what was the hardest thing on your course then, Ali?
I think the hardest thing initially was looking at the referencing and the academic writing and getting into that mode of working. But you get an awful lot of support, and you can have library sessions, and it's great because you really step out your comfort zone and challenge yourself, and there's a real sense of achievement, and by the end you're like a pro at it and really enjoying it. But I mean, I found it daunting going back to uni at age 50 because there were a lot of young people, but actually you know, once you'd embraced it, it was just a great opportunity. And I would say, if anybody's thinking about it, because I'd ummed and ahed for ages, just do it. Just do it, because I'm enjoying work so much more now I'm qualified, because it just opens up lots more doors, and you just feel that you've got a completely different outlook on things from the experiences from the placement. Because I'd never worked in a hospital. I'd always worked at in primary care. So it just gave me a different insight into what I asked to do at King's Mill was to go to places that I would be referring to. So to see the referral process and what the patient's journey would look like, and then you can use that then in practice.
Brilliant. It's always good to see things from the other side as well. Any other questions from anyone? So Sheila has put, you mentioned the revalidation procedure. So do they too have to revalidate?
Yes. Yeah, nursing associates are part of the revalidation. I'm going to talk about that in the next part if you can